The research evidence tells us that when we're sitting with a patient as a provider, we have all the information we need only 1 out of 3 times. Having the right information at your fingertips is critically important.
In that care moment that's so life-changing, I mean, low-quality information at that point would be life-threatening.
Some experts believe that medical error is the 4th leading cause of death in our country.
Working, especially in a hospital, is a little bit like going to war. It's unpredictable. Every person is unique. You need to have what's important to make them well right at your fingertips.
Historically, in healthcare, clinicians have had to search for that answer.
Relied on textbooks, relied on journal articles, and you relied on those physicians and nurses taking the time and then actually remembering those specific nuggets as they're taking care of specific patients.
The volume of research that comes at us is very hard to keep up with.
We are just bombarded with changes constantly. New medications, new testing, new technology. Evidence-based care is the lifeline of the patient.
That's when you want to have confidence that you have, in fact, the best possible latest content, and you want to be able to provide that in that instant, in that moment.
Zynx basically takes the best practices that have been identified in the literature, the evidence, the peer-reviewed studies, and translates that in a way for clinicians to use it as part of their regular everyday workflow. And the secret sauce is really our clinicians combing through their literature and identifying those specific vital interventions that matter the most.
There's always a chance that choices might be omitted or things might be substituted that aren't optimal. Zynx provides the checklist, the choices when you're receiving care from the physician or the nurse or the pharmacist.
We'll do the heavy lifting of the literature searches, keeping up with the guidelines and performance measures so that the physicians and nurses can focus on the patient.
Zynx Health gives the end user the right tools at the right time.
Zynx provides solutions that support the inpatient setting, the physician office and the ambulatory setting, the rehab and the nursing home, no matter where the patient is in their journey. If you're in an inpatient or a hospital setting, a physician may need to pull up a checklist or an order set. A nurse may need to pick up a similar type of checklist, but something that's been customized to their particular workflow. And then if you switch the gears and look at the outpatient setting, you need this similar evidence base, but how that gets translated, how those checklists get used, maybe a slightly different format, again, customized to that physician or nurse.
It comes down to that granular level. And Zynx has become a verb in our institution to say, would you Zynx this?
The success of Zynx is that we've slipped it so into workflow that it's just part of everyday business, and I can get back to sitting at the bedside with my patients.
I think Zynx has taken that big leap. It has put evidence right at your fingertips. It has helped us tremendously.
Anytime you need to make a decision about a care moment, we're there.
At the end of the day, you have to give the best tools to the physicians, and they will do the right thing.
A lot of us are really open to trying to understand how we can deliver healthcare in a way that's never been done. And I think that's a really exciting place to be.
What excites me most about the work that we're doing at Zynx Health is really that ability to impact a much larger population of patients. The opportunities are really endless.
There's always going to be the art of medicine. Information in the right order, in the right place, at the right time for that patient help facilitate moving the provider back to the bedside, back to the patient's side, bringing back more of that potential human interaction.
And that's what all this is about.